A groin strain is the most common injury in the NHL and pro soccer versus hamstring that you will see in the NFL. Groin strains are going to include the hip adductor muscles as well as the iliopsoas. The mechanism of injury can be things such as an acute eccentric overload, associated hip abduction and external rotation, and your early season DIF. Signs and symptoms include localized edema. If it's an adductor involvement, you're going to have medial pain and limited lateral movements. If it includes the iliopsoas, there will be deep anterior pain and limited hip flexion and extension. With this type of pain, you want to rule out femoral neck and coxofemoral joint injuries. Range of motion will be decreased, active and passive range of motion for hip abduction and external rotation. A Thomas test is going to be used to assess the iliopsoas, rectus femoris, and sartorius. During a Thomas test, the person simply pulls the knee to their chest, lays back, and you as an assessor takes a look at the opposite hip and leg. When the hip comes off of the table, that is positive for a tight iliopsoas. The leg may also extend out at the knee, which is going to be something that you see with a tight rectus femoris. An Eli's test can also be performed for a rectus femoris. In this test, the patient lies prone and flexes one knee to the buttocks. The pelvis should remain on the table. A positive test occurs when the hip flexes while the knee is flexed, indicating a tight rectus. This one should be completed bilaterally so that you can compare both hips. Diagnosis for groin strain includes an MRI, and if it is to the iliopsoas, that X-ray to rule out femoral neck and the other joint pathologies if symptoms warrant.